Welcome back to Dental Unfiltered. I'm Matt Brown. I'm here with my normally co-host Dr. Vallo, who's had a lot of life changes with a new child and stuff, and has been blowing off our audience. But he's been dealing in the trenches of second fatherhood and not sleeping. So hey guys, me and Andrew are back together. We're gonna start getting back on our normal recording schedule. If you missed a few episodes with us, today we have a really awesome podcast episode for you. It's called Second Chances. And I think this is a really good subject. I feel like a lot of you guys get focused on only treatment gets closed in the operatory first pass. And I think Second Chances kind of thinks about a lot of things and having a second pass. So, Dr. Vallo, this was your idea to do this episode today. Tell me what your motivation was, and welcome back.
Yeah, thanks, Matt. I missed it. Normally, Matt and I we get together at least once a month and kind of carve out a nice recording session to get through some episodes. But we missed ours last month. It was my fault. I mean, we had our second child. Our daughter was born on May 7th, and obviously things are crazy. And I never time things well. We're planning. If all goes well, to open 4 new offices over about a 2-month stretch here. And we just opened the first one of those, which is office number 11 this week, which is in Venice. So life's busy, new baby's colicky, not sleeping well. We're not sleeping well. Um, but everyone's healthy, which is all we can ask for. And I'm excited to be back, and I'm excited for today's episode, guys. This is going to be some good stuff. So I believe I may have briefly mentioned this in another episode recently, but we started my so let me backtrack for a second. My main role as CEO these days, guys, I think I've said this before, I'm not super involved in our day-to-day operations anymore. So we've got office managers, we've got a regional manager, we've got the COO, we've got chief sales officer who heads the treatment coordinator department, we got chief hygiene officer who heads the hygienist. We've got now, and actually I don't think I even announced this yet, but one of our associates just also took on the role of director of doctor relations and development. So I've got kind of people that are handling the day-to-day and the interpersonal relations and all that good stuff. My main focus as CEO on a day-to-day basis is I am looking at our big systems, our big levers that we can pull, our dials we can turn, and trying to figure out what changes will have the most impact, what has the best upside with the least downside risk, how can we look at implementing things. And so one of my main focuses the last 6 months or so has been our sales department, our working closely with our chief sales officer, trying to increase KPIs with treatment acceptance, and obviously the higher the treatment acceptance, the higher the collections are likely going to be for the office. So it is like a direct, has a direct correlation to increasing collections, increasing revenue if you can fine tune your sales system. One of the changes we made recently that, again, I think I touched on briefly was we started implementing a kind of a mandatory scheduled follow-up financial consultation for any patients that don't close treatment right at their consultation or exam. So we used to, we had our 222 system, which we still do, in a sense. But it used to be, hey, let's really focus in on same day close them same day same day treatment's great, but at least collect the money, schedule the treatment. And then if they didn't, they went in the 222, where then our treatment coordinators would follow up with them. And there's different things they do: call, text, email. There's a letter that we send out, things like that. And they were doing fairly well with the follow-ups, but once, as everyone knows, once a patient leaves the office, the likelihood of them doing treatment goes down dramatically. It is much tougher to close someone via text or via email. Phone is probably the next best thing, but even that is pretty challenging, and that's if you can get them on the phone. And I don't know about you guys, it's kind of tough getting people on the phone these days. So, something I learned from the Hermosi event, because, they do it via Zoom, which I think it's something we've actually talked about, but we haven't tried yet. But if you don't close, right away, then they immediately, before they let you off that initial sales conversation, they schedule the next follow-up. And they try to do it the next day. ideally, or 2 days from then. So we're having our TCs do that, and we're actually tracking it. So now we're not only tracking what percentage of the patients they present to are they closing that day, we're also tracking what percentage of the patients that they didn't close are they getting scheduled back for that financial consultation. And I'm going to go into some more details about exactly how we do it and how we're motivating patients to come back in and all that. But I'm going to stop for a second, let Matt kind of interject with any thoughts or.
Yeah, no, I teach case presentation training around the country all the time. If you're listeners and you're in Dr. Rehan's group, Practice Success Academy, or Avi Patel's group, or any of the groups I work with as an educational partner, like one thing I always talk about during my presentation is like, one of the biggest holes in a practice is follow up. Like, I mean, every practice. Like, I mean, like literally, almost every practice I go to, it's like, what's your follow up process? And no one can tell me a process, which means it's not happening. And a really good case presenter is really smart. Um, One time, his name is Blake Dyson. One time, he told me he was like, more treatment is closed on good follow up than is in the operatory. And I started watching it, and I don't know if it's more, but I know there's a lot there to be closed.
I'll interject and I'll say I hope it's not more, because and this was an important distinction that I made to our team and our CSO. And so we have weekly sales meetings where our treatment coordinators and sometimes the OMs are on it, but our CSO heads it. And I'm not there every week, but I will join, and sometimes I'll just join for 10 15 minutes to kind of say something or whatever. But basically I told them, like, when we rolled this system out, hey, obviously I want you to focus on getting these booked, but I don't want you to do it at the expense of closing in operatory. It's like, this should be the last resort. So we've been training our TCs to overcome objections and not take that first no for an answer and all that stuff. So I didn't want this to be an easy out for them. And I told them that point blank. I was like, this cannot be an easy out. You can't just be like, oh, the patient said no, so let me schedule them for the financial consultation follow-up. Like, you have to still go through the entire process. I don't want to see your daily acceptance rate drop. So like, if we have a TC that's doing 75% daily acceptance rate, and then all of a sudden it's like, oh, she's booking a bunch of follow-ups, but her daily acceptance dropped to 55%, that's not a win. Like, that's a loss. We still want to, because here's the thing, like, they may not come back for that, even though we have some things to try to make them come back, but they may not come back for that second follow-up. So, and I know Blake, and he's a genius when it comes to, treatment acceptance and sales. I think
He came in. Did he come and visit you? Yeah,
he
he
did.
did. Yeah.
He was down with you guys, and actually we helped him out with a patient that was in Florida that needed something,
Okay.
a few months ago. But he's
Yeah.
he's a good guy. My point of all this, guys, is like, I think it's both. Like, you can really focus on that daily treatment acceptance, the acceptance at the initial consultation or exam, or whenever treatment's presented, and not focus on the follow-up, and you could do pretty well. I mean, if you're getting that daily acceptance rate at 75-80% and you're not doing much of the follow-ups, you're going to do pretty well. Or you could, and actually we do have a treatment coordinator that's not as strong with her daily. I think she struggles overcoming the objections in office. She doesn't want to seem too pushy, but we call her the queen of follow-up because she closes so much damn treatment on follow-up. So, and I mean, her office does pretty well. It would do better if we could get her to increase that daily acceptance. So it's both. If you do both, if you really focus on the daily acceptance of your treatment coordinators and you really focus on the follow-up process, that's when you can have those killer offices. Like, those are our offices, like West Chase, like BV Riverview, like Fort Myers, that are doing 300, 350, 400K plus a month. It's because they've got both dialed in.
One thing I would love to know, and love to know your thoughts on this, is Blake says more follow up or more treatments closed on follow up. My question is over a certain dollar value closed more on follow up than in person? Like, if we breach 10,000 and that's a bigger decision, is a higher percentage of the more expensive treatment plans closed on follow up because of it being a heavy decision? Like, is there a dollar value break where we see it shift where follow up is the key to that dollar value?
Yeah, I mean, and that's a fair point. I don't have data specifically to speak to that. But obviously, it's a smaller hurdle to overcome to get someone to accept a $2,000 treatment than it is to accept a $20,000 treatment. The $20,000 treatment, they're probably more likely to want to think it over, to want to maybe get a second opinion, to want to talk to their spouse. But again, my argument there is once they leave the office without committing, like your likelihood of closing the case goes down significantly, even if you have a good follow-up process in place. So like we have ways to try to combat it, even with the big dollar amounts. We're like, listen, typically you're approved for financing. You've already said you can handle the monthly payments. I understand you want to talk to your spouse. Like it's either let's get them on the phone right now and let's figure it, or if we can't get them on the phone right now, it's hey, you're coming in for our summer sale. You're saving 60% on your dental implants. You're approved for this great payment option with, low monthly payments. I think your husband, and we're offering you an extra same day discount to move forward. I think your husband would be upset if you didn't take this deal, if you didn't save this money. And I actually have a TC that's really good at kind of, giving that retort back. And
Every doc and TC that's listening that's like, I don't want to be a slimy,
yeah,
salesy, pushy person, just
yeah.
went, there it is. That's
Well,
it right there.
and I'll be
100%.
honest, man, every one of our TCs kind of has a different style. I think she says it like almost in a joking way, and I think she has such rapport
She
with the patient.
says it.
Well, okay,
She's a good,
that's
I
fine.
tell you what, I respect it.
Well,
So
yeah, and I mean, here's the thing too, guys. Like, if someone accepts the treatment and then that night they go home and they talk to their spouse, and their spouse is not on board, and they call us back the next day and they want to back out, like obviously we're going to try to bring the spouse and we're going to try to talk to them both about it. And again, guys, remember, we're not trying to sell them a timeshare. We're not trying to sell them a watch.
we're trying to save their mouth.
We're trying to improve their health. So like this really is something that benefits them. Like, yes, I get it. We have to find ways to get them to understand the value and to value it. But like I really don't feel bad about using different sales approaches because I feel good about what we're selling. I feel good about the service we're providing. I feel good about what we're doing. And again, to that point, like obviously we don't want to cause fights within a marriage. If someone comes back the next day and they're like, hey, I talked to my husband, he's not on board. Our first goal is like, let's try to get them both in together to kind of go through it, have the husband meet the doctor, have the wife, whatever it is, and see if we can still help them move forward. But if not, like obviously at that point in time, we're going to let them walk away from the treatment because we haven't started the process. So, there is that we like, I don't like quote unquote refunds. I don't like patients backing out of treatment, but like that's a different case. If we get someone to commit right away and they haven't actually talked to their spouse about it and they do come back the next day, like we're going to let them off the hook at that point in time, because we totally understand the situation. But again, I would rather them close that day and then us have to, let them back out the next day than have them leave to go talk to their spouse and then never come back, never answer the phone, whatever it is.
So follow up's a failure in every practice, and we don't want to be slimy salespeople. But first, to go back to it, your job, I can't say ours. I'm not a dentist. Your job is do what's best for the patient all the time, which is get ahead of the dental problem, right? So if you use a sales tactic, like I don't think your husband would want you to, which she may say jokingly, right? When you say no to this deal, right? She still is good enough to say it, which is pretty impressive. Um, and then they don't get treatment, and it gives you a second chance at talking to them if they try to back out again as a second touch. That's better than them just walking out and having no hope of getting treatment. Like this, like you know, the sales tactics aren't evil. Like the outcome's a good outcome. Like we're looking to give them a new smile, let them eat normally, have them be out of pain, be more comfortable. So you shouldn't feel dirty about helping somebody get there.
Well, and to your point, Matt, like is that maybe pushing the envelope a little bit? Maybe, but I would argue that most dentists and most TCs are at the far other end of the spectrum.
No, no, they're way the wrong direction.
So worried about like coming off as salesy that like they won't even try. A lot of offices aren't even asking for the close. They're literally like,
No, just let
this
us know.
treatment, and they're like,
Here you
yeah, yeah,
go.
exactly. Yeah, if you want to do it, let us know. And
Yeah.
that's so. And I think honestly, I think that's way more of a disservice because you're not helping the patients understand the value. You're not helping them get the treatment they need. And like, let's face it, guys, we all have dozens of things that we need to do that we need to pay for, and we need to prioritize one way or the other. And if your dentist and your treatment coordinator doesn't act like this is important and you should prioritize it, like, are most people going to really prioritize their dental health over other things that they may want to do? Probably not. It's our job, it's our responsibility to help them value this dental treatment. So
It's funny, like they don't want to be pushy, right? And then they're the far end of the spectrum, but it's the same ones who say, how's your follow-up process? Why I don't want to annoy my patients. I don't want to bother them.
oh yeah, or like the reviews. Oh, I don't want to ask for reviews because that might rub people the wrong way. And it's like, well, that's why you have 30 reviews, and that's why the practice next door has 800 reviews. So
It's like rub people the wrong way. Like when you go to any business in America now, they're asking you verbally for a Google review. It's the preferred, like it's a normal consumer behavior now. Like wake the F up. It's not 1985. Like Google dictates our world now.
with patients trying to cancel, and this is something that drives my team, so many of my team members. Like, I always talk about being chief repeating officer. This is probably the number one thing that I have to repeat, and I've probably, I don't know, freaking hundreds of times, like, reminded my team, talked about it in meetings, sent emails. People just really don't like to try to help patients keep their appointment. I don't know what it is, but like, that has been one of the biggest struggles I've had in the organization. And I've gotten to the point now, every time I see somebody where a patient canceled and there wasn't a legitimate attempt made to help them keep their appointment, I am sending a text or email to that office manager with our regional, with our COO, like our entire executive team. And I'm like basically calling them out. And I'm like, guys, what happened here? Like, this is not protocol. And so like, I think finally I'm getting a little bit of traction because like I used to just like grumble and be like, oh, but again, then I'm the problem because I'm not teaching every time that there's the opportunity. And again, is that the best use of my time? I don't know. But I'm in offices every single, like inside remotely in offices, checking on things because I need to have a finger on the pulse of what's going on in the organization. So like that is, I would say that's probably one of the more quote unquote day-to-day things I do is audit patient communication. And like my regional manager is doing it too. But I mean, think about it. We've got now 11 offices and how many thousands of patients. So it's like there's only so much auditing that can be done. We need to have trust that our team's doing it. But anyways, I'm getting off topic. I'm just basically, people don't like those uncomfortable conversations. Yeah. So let me get to how we encourage patients to come back for these financial consultations. So treatment coordinator goes through the process. Patient's not ready to commit that day. They've done the whole spiel. It's not going to happen. Okay. Hey, I totally understand. I get it. You need to go talk to your spouse. You need to, figure out schedule, whatever, which, I'd rather them just schedule something and change it. But whatever reason, they're not doing it. Let's do this. I know life's going to get busy. Let's schedule a time for you to come back. You don't have to meet with a doctor again. We don't do more x-rays. It's just going to be like a 20-minute follow-up meeting with me so that I can answer any other questions you have. We can go back over different, financial options. And to, thank you for coming back and meeting with me. I'm actually able to give you a $200 office credit. So that credit can be used towards that treatment that day if you move forward, or even if you're not ready then, you can still apply that to treatment in the future. So 20, 30 minutes of your time, you're going to get $200 in office credit. And that way, other questions come up, I can answer them for you. My next available times for these meetings, I've got this day at this time, this day at this time. What time works best for you? And then we created a separate column on all of our open dental schedules that just says financial consultations. And we schedule them just like we would a regular patient. They get reminders just like the regular patient. And I'm having our TCs take it one step further where they're we've got the automated reminders and confirmations, but they are personally sending a manual flex text message to these patients the morning of and saying, hey, I know you're getting our automated reminders, but I just wanted to personally reach out and let you know I'm looking forward to meeting with you again today, and remind you it's going to be a quick visit, and I'm going to be able to give you that $200 credit just for coming in. So I will tell you, we've only been doing these financial consultations for maybe 6 weeks. The first 2 weeks, I noticed the no show rate was astronomical, and I was like kicking myself. I'm like, dude, these are people that have already been in the office. I can't believe they're not showing up for this second meeting. And at that point, we were only offering $100 credit, and we weren't having the TC send that second follow up. So we increased it to 200. We had them send that manual. Now we're still seeing more no shows than I'd like, but the rate has definitely come down. So now I'm actually looking at taking it a step further. I'm looking at creating some kind of like gift card per se that's gonna have a spot to put their name, $200 office credit, all that stuff. And the TCs are gonna write the date and time, so it's like an appointment card, date and time of their consultation.
Paid appointment card.
Give it to the patient and let them know all you got to do is bring this card to your visit, and I'll be able to then apply that $200 credit to your account.
We have to wrap it up, but I want to say one thing about this. This is really good. When I teach my course, stress and anxieties is the beginning, and one of the top 4 stress and anxieties for a patient is time. So you just compensated them for allowing you to have their time a second time. It's so smart. So I want to wrap it up here, guys. Listen, doc, if you're listening, case presenter, if you're listening, okay, please heed these words. First of all, our job is what's best for the patient all the time. Your job is to get them to care. If in the process of getting them to care, getting them to dental care, you feel uncomfortable, like you're going to make your third follow-up call or your first one or your second one, where you're going to ask for something and you have that uncomfortable feeling like, I don't know if I can do this, that means you probably should. That means you're outside your comfort zone and you're probably doing what's right. When you don't want to do the follow-up because you say, I don't want to harass the patient or bother them, what you're really saying is, I'm selfish, I'm uncomfortable doing this, so I won't do it because of my own feelings. You're wrong. Go do the follow-up. Just do it. And just service the patient and get them back the treatment. You're doing what's best for them.
The level of your success will be equal to the amount of uncomfortable conversations you're willing to have. Absolutely, 100%. And guys, I'll end on this note. You know, I know Matt tells me all the time, he sees people at conferences, they say, how does Dr. Vallo do it? How does Andrew do it? Guys, I'm not like I didn't grow this group to 11 offices, hopefully soon to be 14, and 20 whatever, 7 million. Actually, we may make a push for 30 million this year. I didn't grow this group because I'm like smarter or better or anything like that. It's literally two things. I'm willing to do things that make other people uncomfortable. Now, again, in my eyes, like I'm doing things that still allow me to sleep at night, but I am finding more creative ways to help patients get the dental care that they need. And I'm willing to, break a few eggs in the process. I'm not worried about, oh, is, Mrs. Jones going to get ticked off because we sent her that second reminder to leave a review? Or is so-and-so going to get mad because we pushed to schedule a second follow-up financial consultation? I don't worry about those things. That and just the fact that I'm willing to put in the work to get it done and take the risk. Like that's the only reason that I've been able to build this group. And that's probably the only thing that's stopping you if you're trying to scale a group. So,
all right, we got to wrap it up here, guys. Remember, me and Dr. Vallo, none of the hosts on the show are paid. Zero are. Dental Unfiltered generates no money. Okay. We do this just as an investment in the community. So please like, subscribe, share, follow, leave a review. Please, we read the reviews. We love them. One of you just left a review for Dr. Sasha saying he's the clinical GOAT, and he is the clinical GOAT. That's why he's on the show. But if you think we don't read the reviews, we do. They're what rewards us for this. So please leave a review. Thank you guys so much and have a great day.